So now I'm going to introduce to you all our speaker because we are short on time. We have about 50 minutes for her presentation. I'm pleased to introduce to you all Jessica White. She has Masters of Science. She's an RD/LD, and she's also a nutrition coach. She has her own company where she performs wellness coaching, and she'll be able to give you more information about that. She's a clinical instructor at the department, at Georgia State University. I'm so sorry, Jessica, I messed that up. In addition, she's currently the critical care preceptor for coordinated program students at Grady Memorial Hospital. She earned both her undergrad and graduate from Georgia State University, and she also earned her National Board of Health and Wellness Coaching Certificate in 2020. So I introduce to you all Jessica White. If you have questions, please list them in the chat, and we'll try to save the last 5 minutes of the presentation to answer your questions. Thank you.
Thank you so much, Cicely. Hey guys, I am so excited to be with you today to discuss a little bit about nutrition and COVID-19. And there has been a lot of research to come out in this last year and a half regarding this. And so we're going to talk a little bit about what some of that research actually says. All right, I have no financial disclosures or conflict of interest with the presented material in this presentation. Okay, so during my time with you, we will look at the major players that have been of interest in preventing or reducing severe COVID-19 infection. So the literature is still trying to fill in much of the gaps that have been of some interest. So articles have been coming out looking at nutrition and how we can mitigate some of that risk. Obviously, most of these studies are going to be either retrospective studies or prospective cohort studies. So most of what we're going to talk about is they're going to be associations, and they're not necessarily showing causation just yet, though there are many, many registered randomized control trials that we are just waiting for the data to be released. So the objectives, we're going to discuss how the key nutrients, vitamin D, vitamin C, and zinc play a role in mitigating the risk of COVID-19, as well as in managing an active infection. We're going to describe obesity's role in COVID-19, discuss how exercise and diet can also help to combat COVID, as well as the severity of symptoms, and discuss how the pandemic has affected malnutrition, and discuss how to incorporate what we know. Okay, so just as a brief overview, COVID-19 is caused by the virus severe acute respiratory syndrome coronavirus 2, and that's where we get that abbreviation SARS-CoV-2. And this is spread person to person through respiratory droplets. It can also spread through tiny aerosol droplets, but the majority of the virus is spread through close contact and exposure to respiratory droplets. So that's when a person is going to cough or sneeze in close range. And the virus itself will infect a person by attaching to the ACE2 receptor, which is the angiotensin converting enzyme 2 receptor. This receptor is on the surface of many, many cells in the body, but they are highly expressed on the outside of our adipose tissue. And so the virus then attaches to the ACE2 receptor, and it will invade the host cell and then replicate. And then after that incubation period of about 2 to 14 days, depending on exposure, people will start to experience symptoms. And of course, like we know, most of the common symptoms are similar to the flu: fever, chills, cough, fatigue, headache, muscle aches, and sore throat. And also loss of smell and taste is fairly common with COVID. But you can also have more severe symptoms like shortness of breath, trouble breathing, persistent pain in the chest, and confusion. So the severity of COVID-19 can range from no symptoms at all, despite testing positive, all the way to critical, where hospitalization is required due to multiple organ failure, septic shock, and respiratory failure. And one of the more severe reactions that we actually see in the clinical setting with COVID is what is called a cytokine storm. And so this is essentially where your immune system is overreacting, which causes harm to your body because of the uncontrolled inflammatory response that happens. And this exaggerated response can cause damage to the liver, the kidneys, arteries, and lungs. And it's why we see so many patients, when they move into a critical need, often need to be put on a ventilator. They're often needing dialysis because of this cytokine storm. And because of the viral nature of the disease and the severe immune response it can have, a lot of nutrition research started being looked at in early 2020 with regards to COVID and helping to mitigate these symptoms. So because COVID-19 is so new, a lot of research, again, is based on looking at many of the nutrients that we already know are involved within the immune system. Some of the research even looked at whether there were aspects of nutrition that can actually prevent getting the infection and then controlling it once someone does have it. So the first risk factor that we're going to talk about is obesity. So obesity has been discussed in general throughout healthcare and in the media due to its effect on a person's health. And that doesn't change when we start talking about COVID-19. And actually, it's of even more particular interest when we talk about the risk factors for COVID and the risk for increased severity. And one of the primary reasons this is because of that ACE2 receptor. Again, while this receptor is found on the outsides of many of the cells in the body, it is more present on the outside of adipose cells, and it's highly expressed on the outside of adipose cells, which makes people with excessive amounts of adipose tissue they are at increased risk. They have a higher susceptibility of getting COVID-19 compared to those that have less amount of adipose tissue in their body. But obesity does go beyond that to increase the severity of symptoms and worsening outcomes. And this is actually due to cytokines. So I'm going to get a little technical. So in the previous slide, I mentioned the cytokine storm that we see with COVID. So cytokines are the mediators of inflammation, and they are proteins that are produced in the cells that actually affect the behavior of other cells. So once a stimulus causes a cell to make a cytokine, such as with an infection, then it acts on the target cell. And this is how cytokines actually help to regulate our body's response to an infection, immune responses, inflammation, and trauma. So when a cell is threatened in the instance of an infection, like with COVID, it will produce a cytokine to affect change in the body, essentially alerting the body that you need to deal with whatever the threat is. And cytokines can be separated into two major functional groups. Technically, there are four, but really we only look at them as two. And they're pro-inflammatory cytokines, and then you have your anti-inflammatory cytokines. And this is where obesity actually plays a key role in our immune response. Cytokine production actually requires a fatty acid substrate, and so your fat cells are involved with the production of your pro-inflammatory cytokines. And generally speaking, the greater the size the fat cell, the higher the pro-inflammatory cytokines that are produced. And this is one of the major reasons why we see an increase in the severity of symptoms and an increase in cytokine storming with COVID-19 in our obese patients. So tackling obesity and weight management is actually really important when it comes to mitigating symptoms and risk for contracting COVID. But again, unfortunately, it is not really an easy fix or a quick fix like some of the other risk factors that we'll talk about. It is something to be aware of and to address. But again, this is not something that is easily a quick fix, but it is something we all need to keep in mind and start to make changes or educate our clients on those changes. So the next risk factor, or a factor that can actually be easily added to a regimen, is exercise. So what the research has actually found is that moderate exercise has been shown to positively impact all immune cells in both the innate and adaptive immune systems. So what's interesting is that I want to be very clear, moderate exercise has been shown to have a positive effect. What they have found is that severe intensity, high intensity exercise can actually be counterproductive when it comes to decreasing your susceptibility to infections. And this is actually because very high intensity exercise has been linked to higher rates of upper respiratory tract infections. So they actually looked at elite endurance athletes that train very heavily, and their incidence of upper respiratory tract infections were higher than those that participated in just moderate intensity exercise. So we know that a person's immune function is higher in people that are more physically conditioned compared to sedentary individuals. So a sedentary lifestyle and an insufficient in physical activity levels reduces your cardiovascular capacity. It also reduces your respiratory capacity, and it results in increased obesity, as well as associated cardiometabolic chronic diseases like diabetes and hypertension. And all of this can lead to immune compromise because of this increase in systemic inflammation and oxidative stress. So it is recommended in people who have not yet had COVID that they maintain a moderate intensity exercise regimen to help improve their immune system or to maintain their immune system. So there isn't really this push for people who are already physically active in a moderate intensity regimen to really push themselves beyond that, really just maintain their moderate intensity exercise regimen. In people who are managing an active COVID infection, the recommendation is varied, and it's really highly dependent on the ability to safely perform physical activity. But some of the recommendations state that if a person does have COVID, but they're not presenting with symptoms, that they can continue with their moderate intensity exercise regimen. So it's just going to depend on the severity of the disease and, of course, your respiratory capacity. Obviously, the more severe your symptoms are, the less likely you're able to maintain any type of physical activity without compromising respiratory status. Okay, so the next one we're going to talk about is vitamin D. This has garnered so much attention from the very beginning of COVID, even till now. So just to give a brief overview of vitamin D. So vitamin D is a hormone produced in the skin from 7-dehydrocholesterol. And then after exposure to the sun. So that's why we can produce vitamin D within the body. After that's been created, it is then hydroxylated in the liver to hydroxyvitamin D, and then it's further hydroxylated in the kidney to 1,25-dehydroxyvitamin D. And that is the active form of vitamin D. And that's the vitamin D that's involved with calcium absorption in the gut. And so vitamin D, over the years, we have found actually acts much more like a hormone than a vitamin in the body. And new roles are constantly being discovered. And so vitamin D actually has been looked at with the immune system specifically and have found to help in 3 ways. One, it has been shown to provide and strengthen the physical barrier of our epithelial cells in our skin, our gut, our respiratory tract, and our urinary tract. It's also been shown to help strengthen natural immunity as well as strengthen our adaptive immunity. And vitamin D has been shown to trigger the production of antimicrobial proteins that actually inhibit viral replication rates and reduce cytokines that cause inflammation in the lining of the lungs. And a recent study actually found that vitamin D can also decrease the tissue damage that is induced by the cytokine storm that is often seen with these severe COVID infections. And some of the literature explains how vitamin D may influence the expression of that ACE2 receptor, the COVID binding site. So there is some interest in looking at vitamin D with preventing COVID-19 infection. There have also been many retrospective studies that have shown that there is an increased risk of COVID-19 and an increase in hospitalization in people who are vitamin D deficient. And one study actually found that the risk of developing COVID-19 increased by 5 after adjusting for age if a patient was vitamin D deficient. So this is really why there's been so much interest around vitamin D and COVID. So it is actually recommended to supplement with vitamin D if deficiency is present in people who have not yet been infected with COVID-19. But once a person is managing an active COVID infection, some of the literature is recommending that vitamin D be supplemented in patients with a vitamin D level of less than 50. So less than 50 is not deficient yet. They're just on the lower end of normal. And so in active management, you want to supplement sooner than in somebody who is pre-COVID. So keep that in mind, and pulling vitamin D labs can be very useful in the clinical setting, and it's very helpful, and it's really easy lab to draw. So this is really one of those risk factors that can be easily added on to care in a clinical setting or even in an outpatient setting. So some studies are seeing a benefit in managing and reducing the severity of symptoms of hospitalized patients when giving vitamin D supplementation. So we are waiting on more randomized control trials regarding looking at specific vitamin D supplementation in COVID-19. And there are many that are currently registered. And so we're just waiting for that data to come out. So we have a little bit more information on causation. But right now we do see a strong association with vitamin D and COVID-19. So the next vitamin we're going to talk about is vitamin C. This one's talked about with the immune system all the time. So vitamin C, which is ascorbic acid, is an essential water-soluble nutrient, meaning our bodies cannot synthesize it. And it plays a significant role, a structural role in the synthesis of our collagen. It's also a powerful antioxidant to support various cellular functions of both the innate and adaptive immune systems, partly by mitigating how susceptible we are to different viral infections. And it also has a role in influencing inflammation. So because vitamin C has shown to improve outcomes and symptoms with the common cold, sepsis, acute respiratory distress syndrome, and pneumonia, there has been that strong interest in its role with COVID-19. So certain cells in our immune system can accumulate vitamin C and they require it for them to work efficiently. So some of these cells are your phagocytes and your T cells, and these are key players in your immune system. So these specifically need vitamin C, and a deficiency in vitamin C causes a decreased resistance against pathogens that you come in contact with. Hence why we're so interested in vitamin C with COVID. Vitamin C has also been found to suppress pro-inflammatory responses while supporting our anti-inflammatory responses and promoting the remodeling and self-renewal genes. And some animal studies have actually come out to show that vitamin C actually increases our lung epithelial barrier function and contributes to downregulating cytokines. So we're seeing that it has a role in actually protecting our lungs from oxidant injury, which is so important when you're dealing with an aggressive respiratory infection like COVID. It is also an essential role in tissue repair, so it does help with that cytokine storming that we talked about a little earlier. Deficiency in vitamin C is associated with increased levels of inflammation and decreased immune function, similar to what we talked about with vitamin D. And there are actually multiple large randomized control trials that are currently happening, but the results, again, have not been published quite yet. But while there hasn't been any evidence that vitamin C supplementation helps to decrease the risk of contracting COVID, we do know the benefits of consuming enough vitamin C, which is easily obtained through fruits and vegetables, with citrus fruits, kiwi, red bell pepper, Brussels sprouts, and broccoli being some of the highest with vitamin C content. I will say you do want to be careful with extremely high doses of vitamin C daily, as it can lead to an increased risk of kidney stones, as well as if you do stop very high doses of vitamin C abruptly, they can lead to what we call rebound scurvy. So if you were counseling clients or patients on vitamin C, you want to make sure that they're not taking mega doses of vitamin C due to some of the risk factors with that. There have been small studies to show some benefit with IV vitamin C supplementation in patients with active COVID infection, but again, we're waiting for those larger studies to come out. They did do a case study of a patient that did have severe sepsis and COVID-19, and this patient was presenting with very high blood pressure, a really high heart rate, declining kidney function, and through the course of his stay, he received a one-time mega dose of vitamin C, 60 grams of sodium ascorbate over 7 hours. And what was interesting is after that, he started to experience a normalizing in blood pressure, a normalizing in his creatinine. He had return of urine flow, his heart rate started to decrease, and he had improved oxygenation. It was not long after that that he was transferred from the ICU, but he was discharged from the hospital 22 days after that mega dose of vitamin C. So because of this very positive result that they've seen from one-time mega dose of vitamin C, those large randomized controlled trials are now looking at the effect with vitamin C on COVID management. So the third and last nutrient we're going to talk about is zinc. So zinc is an essential trace element crucial for growth and development and the maintenance of our immune function by helping to control the oxidative stress and inflammation in our body. But zinc also has a specific antiviral action, so it helps to inhibit the replication of coronaviruses. And so zinc has multiple roles in the immune system. It helps to regulate our lymphocytes. It also helps with our development and function of our innate immune system. And so some studies have shown that zinc supplementation does help to improve markers of immunity. It actually helps to improve vaccination responses and reduce respiratory tract infections. And we have seen some of the literature report an association with low zinc levels and an increase in the risk of COVID, as well as an increase in severity. So zinc supplementation in patients hospitalized with COVID-19 is reported to reduce the risk of poor outcome, including mortality. And some studies have actually found that there are increases in discharges home, a decrease in the need for mechanical ventilation and transfer to the ICU, and a decrease in mortality when we are treating with other medications like hydrochloroquine. So like some of the other actual medications that we're treating for COVID plus zinc. So not zinc alone and not the actual other treatments for COVID-19, but when we combine those two, we're actually seeing a large improvement in outcomes. And again, there are registered trials that are looking more at zinc and COVID management supplementation. But for now, we are showing that treating deficiency is promising in managing both risk of COVID as well as an active COVID infection. So I just want to briefly talk about malnutrition and how it has been affected by COVID-19. So malnutrition is often thought of as the opposite of obesity, but the official definition is actually the incorrect amount of nutrition. So we have malnutrition can mean any overnutrition or undernutrition, though it's often by and large used interchangeably with undernutrition when we're discussing it. And so for the purposes of today, we're going to be speaking on undernutrition when we refer to malnutrition. So the pandemic has increased the amount of food insecurity that is happening in this country as well as worldwide. So the pandemic, of course, has affected each country differently, and it has had a worldwide effect on every economy. But the most vulnerable populations have been faced with many, many management issues. They've faced economic downturn. They've faced unemployment, an increase in food price. They're managing food supply shortages, especially due to a disruption in the food supply chain and a disruption in healthcare services and medical services. So when the world shut down, the most vulnerable people in the population were left pretty much fend for themselves, and malnutrition continued to ensue. And so we know that when a patient has malnutrition, that they have worse outcomes. People with malnutrition are more likely to become sick, to stay sick, and to die from their illnesses. And their hospitalizations are generally complicated by malnutrition. And a lot of this is because, quite literally, your body does not have the tools to defend itself. The immune system relies a lot on nutrition, as we saw in earlier slides. And so malnutrition leads to deficiencies and insufficiencies in many of these key nutrients, which increases the risk of contracting COVID, as well as complicates the management of that illness. So unfortunately, unlike a single vitamin deficiency, like with vitamin D or vitamin C, solving malnutrition is not as straightforward as simply drawing a lab and supplementing that nutrient. So it is multifactorial, and there are many different ways that we need to start to address tackling the issue of malnutrition. And so the 2020 Global Nutrition Report highlights how deep this issue goes. And so they state malnutrition, right, is not simply a matter of personal choice. People aren't choosing to be malnourished. And when you start to look beyond just the surface of malnutrition, which is, let's just get them to eat more, you are hit with many of the disparities and inequalities, with two of the biggest factors being lack of access to affordable quality nutrition, and as well as lack of access to healthcare. So tackling this problem requires a nationwide effort, and the Global Nutrition Report has some key ways that we are able to start to tackle this issue, with one of them being that nutrition should be included in healthcare coverage. And right now, that's just not the case. We don't have universal healthcare, but Medicare covers some nutrition services, but only if you have diabetes or kidney disease or a kidney transplant with a referral from a doctor. So this is a large gap in coverage that does not fall under these, if you don't fall under these comorbidity states or categories. The global report also discusses the need for the food systems to change to provide more nutrition equity by addressing the imbalances in the food system and bringing together the global, national, and local markets to better solve this issue of essentially the food system, the food logistics on how we get food to different places. That's a big player in how we can start to tackle malnutrition. And a big one that was discussed in the report is ensuring equitable nutrition by and large. So when you're looking at nutrition, there are multiple ways that as a society, we need to address nutrition. So access through location of affordable, healthy food options. We need to start addressing the widening socioeconomic gap that further exacerbates malnutrition and health disparities, which COVID-19 really just further exacerbated the socioeconomic gap, with so many becoming unemployed. And so that burden widened, and also addressing the policies in place that prevent us from building equitable and sustainable food services, as well as access to nutrition services. So again, like obesity, malnutrition is not an easy or quick fix and touches on very large societal deficits, but it is an important issue that shouldn't be overlooked as we continue to manage and move through what is our new normal and manage COVID being here. So with all that being said, it is probably very obvious that diet plays a large role in the immune response. Some of the recent studies have looked at healthcare workers and diet type and incidences of COVID, as well as the severity of symptoms, and found that people who have consumed a plant-based diet or a pescatarian diet were associated with significantly lower odds of moderate to severe COVID-19 illness when compared to those who didn't practice plant-based or a pescatarian diet. So what is interesting is the food type breakdown that was significantly different for the people who followed this type of diet. And so they found that it was really the total amount of vegetables, legumes, and nuts. They consumed significantly higher amounts of those, and then they consumed significantly less red meat, poultry, sugar-sweetened beverages, and alcohol. So when we're looking at our diet as a whole, this makes sense, right? When we think about a diet that is high in the key nutrients like vitamin D, these are going to be foods like mushrooms and seafood. And foods high in vitamin C are going to be your citrus fruits, lots of fruits and vegetables. And seafood and legumes are also high in zinc content. But overall, the nutrient profile of a plant-based or a pescatarian diet supports the body's immune system and the anti-inflammatory pathway compared to diets that are not plant-based. And so thinking of our anti-inflammatory pathways, that brings us to another nutrient that you will see in our diet, which is our omega-3s. So our omega-3s are polyunsaturated fatty acids where the double bond is positioned closest to the methyl group. And this double bond is going to affect the function of the fatty acid. And so it's either going to make them pro-inflammatory or anti-inflammatory. And so your omega-3s are going to be more anti-inflammatory, whereas your omega-6s are going to be more pro-inflammatory. Now, it doesn't mean that we're not supposed to consume omega-6s. Omega-6s are actually really important because they're going to help stimulate skin and hair growth. They're going to help maintain bone health and regulate metabolism, as well as maintain our reproductive system. So both are needed. So what is the problem? The problem is that the typical American diet has 14 to 25 times more omega-6 content than omega-3 content. So our diet, the typical American diet, tends to be more pro-inflammatory because omega-6s will start to produce more pro-inflammatory cytokines. So while omega-6s are needed, they aren't needed in the extent that they are currently consumed. So omega-3s became of particular interest when we're looking at diet because they provide substrates for our anti-inflammatory cytokines. And so you can see from the chart on this slide, you can see omega-6s that comes from safflower oil, corn oil, soybean oil, as well as meats and organs. And so this can lead an excessive consumption, right? I'm not saying don't consume this, just an excessive consumption will lead to more inflammation, whereas our omega-3s, which come from fish and seafood and seaweed, right? More of that pescatarian plant-based diet helps to decrease that immune response and inflammation. So now that we have all of that knowledge, how do we best apply? So I don't want to bog down in the details at this point. If you are going to be educating patients or clients, that we really want to take a more broad view and that we don't want to recommend everyone go start to just buy a lot of supplements. I first say, let's tackle the diet, right? So your general nutrition aims is that increasing our consumption of fruits and vegetables can start to increase our consumption of a lot of these nutrients that really help to support our immune system. So making your plate half fruits and vegetables, with most of that being vegetables, a fourth of your plate being lean proteins, and making sure to, if you are eating actual meat products, to incorporate seafood into the diet, and then making a quarter of your plate complex carbohydrates. The other thing that we want to start to recommend, right, is if you aren't physically active, become physically active, physical activity does so much for our immune system. It helps to reduce anxiety. It helps to decrease the risk of type 2 diabetes. It helps to decrease the risk of hypertension. It also helps to decrease the risk of all-cause mortality. And so, again, we want to recommend moderate intensity aerobic activity, not high intensity. So what does that correlate to? How can I know what is moderate versus high? So walking slowly is considered a light intensity activity. And brisk walking is an example of a moderate intensity activity, and it includes walking and talking, but you wouldn't necessarily be able to sing. So you may be able to hold a light conversation, but you're not necessarily able to use up a lot of respiratory needs through exertion like singing. And then vigorous intensity physical activity, so that high intensity, you would only be able to say a few words without needing to catch your breath. So you definitely can't sing in a high intensity, but you almost can't talk either. So that can be a little bit of a guide on what's the difference between your moderate intensity activity and your high intensity. So if a person isn't already active, they don't necessarily need to focus on the intensity right away. The goal, of course, is to get more active and then to work up to moderate intensity aerobic activity. I wanted to put this here because fluid is actually another big factor when it comes to managing COVID and maintaining health. Hydration is actually very, very important. And so making sure we're drinking enough or recommending enough fluid is actually really important. There are many different methods. The easiest one is generally the 1 milliliter of fluid per calorie of calories consumed. So the general 2,000 calories would be about 8 cups of water per day. And that's really where that, quote unquote, the 8 cups per day, everyone needs it. And that's not necessarily true, because if somebody eats far less than 2,000 calories, they don't need quite that much fluid. And if somebody's eating significantly more than 2,000 calories, such as an athlete or somebody that's training heavily, they would actually need a significantly more amount of fluid. And so I just put this here. I know I'm coming down to my time. So as you start to either incorporate some of this knowledge in your own practice or in your own life, or educating clients, just making sure that we look at the big picture first. A lot of the details of nutrition, we can get bogged down in a lot of that. And it's really important that we really take a step back and make sure we're hitting our big points first, before we start to tackle some of the nuances. So if we're not eating appropriately, putting a supplement onto a poor diet does not improve outcomes and risk factors, right? If we're not consuming a varied diet, if we're not physically active, just taking a vitamin D supplement alone is not going to be the cure-all for risk factors or even managing current illnesses. So just making sure that we take a big picture first approach, and then once we get those handled, then we move into the details second. And these are just references for general nutrition. And so you guys can definitely use these to refer clients to or to get more information. And then these were my references. And then any questions? Okay, I'm gonna stop sharing.
About 7 minutes for questions. So if you guys have questions, go ahead and put those in the chat box. And I sent out the link to the sign-in sheet, you guys, and you'll send the email. You'll have to request permission, and I'll let each add their information.
This is Mike Powell. I have one quick question.
Yeah.
For someone who is post-COVID, what are some of the preventative nutritional components they can integrate at that point, just to keep their immune system built back up?
Yeah, so they are looking at some of the post-COVID management in the research. There isn't I didn't see anything that was as solidified, but I would say I would almost go back to pre-COVID recommendations, which is making sure that you're eating enough to support the immune system, one, and making sure that you are you have enough of your vitamin D. Vitamin D is a big one that can actually help with some of the symptoms that people may be experiencing in the long haul, especially if you have more long-term symptoms. And so vitamin C, zinc, and vitamin D are still pretty important in the post-COVID nutritional care. So also getting back into physical activity can help, but you want to, again, get cleared by your doctor with that, depending on how severe the respiratory infection was for you. And I would say making sure that you still have a varied diet and that you aren't, a multivitamin can also be of help in the post-COVID population, depending on your pre-COVID nutritional status. So it's just going to depend, but they are seeing some benefit to multivitamins. They are also seeing some benefit if you were on major antibiotics and looking at reintroducing good bacteria to the gut. So some of the post-COVID nutritional care can revolve around good probiotics to replenish your gut microbiota, since that can take a pretty big hit depending on the medications that you were prescribed.
Thank you.
Yeah.
Are there any other questions? You'll need to ask for permission. I'm getting to each one of them and allowing permission as I verify. So as you click on the link and need permission to sign in, just request permission and I'll get you done.
Hi, this is Courtney Underwood. I had a quick comment. I don't know if it's a question, but I do know that I've heard different individuals mention that working out, but they mention it like during having COVID, that it actually helped them to get better sooner, or they felt better, or they didn't experience such a, I guess you could say, extreme or severe case of COVID. So I just thought that was very interesting to see that in the research that you presented on today.
Yeah, that's the anecdotal evidence too is there as well. It is interesting to kind of see, and I think what they're looking at is essentially if they already had a regimen, that your ability to maintain your respiratory status and your respiratory capacity really is improved and expanded compared to people who have not worked out. And so working out in terms of decreasing inflammation and then increasing your respiratory capacity really does help to mitigate some of those symptoms. So the exercise is an interesting component. And if COVID's not severe enough, definitely keeping your exercise regimen is helpful.
I guess that says a lot though, for working out through COVID, not necessarily quarantining and social distancing either.
Yeah, I guess you could work out at home. You throw on a YouTube video. That didn't work for me, but I was not very active during the shutdown. So yeah, that is a barrier for many when the gyms are, when you can't leave the house. But
okay, do we have any more questions? We will be going back into full session at 11 o'clock. For the time being, I am allowing access for each individual that make the request on the document. I'll be sending out the certificates. If you're IBCLC, make sure that you note that it is 1 RCERT for related for IBCLCs. and 1 continuing ed, of course, for the general attendees, and 1 CPE for RDs. If you have any additional questions, then feel free to, most of you guys know me, you can actually email me. You can email nutrition at Georgia DPHA, or you can email me on Cicely.Thomas at DPHA. Excuse me, at dph.ga.gov. I got too many emails going on. I thank you guys for your attendance. Please, please, please consider joining GPHA. Our nutrition section is kind of small right now, and we need your participation. We need dietitians, nutritionists, IBCLCs to represent Georgia. And Jessica, we so greatly appreciate you and all of your knowledge. Thank you, guys.
Thank you so much for having me. If